Okay, so this is my video for the SBAR. So what the SBAR is it's a way for nurses to communicate with nurses during a shift change, or nurses to communicate with a provider if something has happened or if the provider needs information about anything. So it's just a way to have better communication, making sure that you hit everything that you need to hit in order for the nurse or provider to completely understand what's going on with the patient. So SBAR stands for situation, background, assessment, and recommendation. So in the situation, you just want to give who you are, where you're calling from, who's the patient, what's happening. In the background, you want to explain their medical history. So you want to know, they want to know like when the patient arrived, what the patient arrived for, what their vitals were. Have they, become worse since they've been in the hospital? Have they gotten better since they've been in the hospital? What medications they're on, things like that. In the assessment, you want to give what their vitals are now, what's happening right now to them, things like that. And then in the recommendation, you want to either state what your recommendations are as a nurse. So if you know that their oxygen levels have dropped, or you know that their fever has spiked, or you know their pain has spiked, asking the provider, can I give oxygen? Can I give a fever reducer? Can I give a pain medication? Things like that. Trying to get a verbal order, or if you're not sure what's happening, you can always ask the provider if they can come down and assess the patient themselves. So, knowing that, we're going to move forward to the situation that I came up with, which is a burn patient. So if I were to call the provider, the conversation would kind of seem like this. So the situation would be, hello, this is Nurse Ari. I'm on the burn unit at Aspen Hospital, in room 222. I'm calling about Mrs. Zox because she has spiked a fever and is breathless. The patient is a DNR, and I'm concerned that she is experiencing sepsis. The background of my patient would be Mrs. Zox is a 41-year-old patient who came in 3 days ago on October 31st with third-degree burns on her stomach and her arms from a house fire. She is allergic to penicillin. She takes metformin for her type 2 diabetes. When the patient did arrive, she was alert and oriented ×4, in a 10 out of 10 pain. And she, her vitals were, her blood pressure was 160/93, her pulse oximeter was 91, and her temperature was around 101.3. When we did do her labs, they came back and showed that she is hypovolemic, and has a low platelet count. Patient is currently waiting to be stable enough in order to have an arm amputation. Her plan of care has been to aid the patient in pain management, as well as continually cleaning her dressings to prevent infection. The patient was given pain medication about an hour ago and still states that she is experiencing a pain on a 10 out of 10 scale. Within the past 30 minutes, the patient has developed a fever and become short of breath, and her skin is clammy. So the assessment is that the patient is now confused, agitated, lethargic, but is able to conversate and still swallow pills. Her blood pressure is now 145/90, her pulse is 121, pulse ox read at 87, and her temperature has spiked to 103.1. So I believe that the patient has developed sepsis infection due to her burns. And then my recommendation would be that I would like you to come see the patient immediately. Is there anything that I should do? Do you want me to provide oxygen in the meanwhile until you get here? So that's my little SBAR assessment on a burn victim who has potentially had a sepsis shock.